acupuncture needle and pain stimulation. You know, many things cannot be pain, P-E-N, not P-A-I-N, P-E-N, pain. Remove this, excuse me, remove this transcription.
Good evening,
Yeah,
Dr.
I'm going to
Sastri.
teach you. I'm going to teach you two techniques right now. One is a physician, one is a acupuncturist, and one is a, please remove this one.
I'm trying to remove it. I believe it's off, sir.
Yeah. See, I'm going to do three objectives. First, as an acupuncturist. Second, as a non-acupuncturist. Third, as a physician. So we will be working with cervical spine. It's a dangerous technique, but with the help of cervical spine needles, acupuncture needles, you can learn many things. And I hope you will be able to do this. It's a very long class, very practical class. I'll try to complete in short, right? Next. So it is called what? It is a very complex pain because it is a nerve compression, nerve root irritation, and it gives a very typical pain inside the brain. So it is called what? A type of complex pain, right? So pain in the osteocervical without point of maximal intensity, not related to specific muscles, frequential, including hypertonia of the skin. Now here you will see non-specific neck pain. See, this neck pain is non-specific because it does not recover, it does not specify any muscles. कोई भी muscles को ये specify नहीं करता और किसी भी तरीके की चीज को ये specify नहीं करता. It does not specify any other factor, but it is a non-specific pain. So it is called non-specific neck pain. Did you understand? Did you understand?
Yes,
Did you
sir.
understand?
Yes, sir.
Yes, sir. Yes, sir.
It is non-specific pain because the specific muscles are, pain of the specific muscles are upset, right?
क्या हुआ सर?
Now there is differential diagnosis. What are the differential diagnosis?
सर आवाज में खटखटाहट है.
मैंने नहीं किया, किसी और ने खटखट कर रखा है.
तो सर वो होस्ट को बोलिए ना सबको म्यूट कर दे.
Mute all the mics. So it may be because of arthrosis of the cervical spine joint pain, myalgia of the deep neck pain extensors, intraspinous arthrosis. So generally because of age or any other factor, there is degeneration in the cervical vertebra. वर्टिब्रा के अंदर degeneration होता है, उसके कारण गर्दन पे जोर पड़ती है. Now because of this degeneration, you have this type of pain. It is called non-specific cervical pain. How to release this pain? I'll teach you a very easy method by which you can do. See, ultimately the concept is what? To relax that muscle. To relax that area, you can use three things. One is injection, one is acupuncture needle, one is pain stimulation. Whichever you want, you can use it, right? Pain stimulation is easy because it does not create any trauma, no danger. There are very much vertebrae. गर्दन के अंदर वर्टिब्रा और नर्व बहुत ज्यादा होती है, तो आपको ब्लाइंड मेथड मतलब आपको ये नहीं मालूम आप कहाँ जा रहे हैं. You do not know where you are going. So you may injure some areas, right? So better to go with what? Superficial system. यानी ऊपर से हम जितना ठीक कर सकते करें, अंदर का काम बहुत कम रखें. यानी whatever we can do superficially we should do. Inner work we should be very minimum, right? Clear. Next. Now you can see local anesthesia is 10 ml. Needle is 0.4 into 20 mm. Now this local anesthesia 10 ml may also create lot of problem in the cervical spine. It may create the patient into coma also. So never try to use these methods unless you are an expert. These are methods of anesthesia. I am teaching you anesthesia, but I have combined anesthesia into acupuncture method. मैंने anesthesia को acupuncture method में combine किया है, right? So you can do it with three methods. What are they? Acupuncture, anesthetic methods, and superficial method. In superficial method also, acupuncture is little bit required because this needle has to decompress the area. 75% of the problems in this can be resolved. Kitna percent? 75%. Yes. Only 25% is not resolved. Otherwise, 75% you can resolve. This is my life experience. Am I clear to all of you? Do you have any questions at this moment? See, I will never like to go with this type of therapies. Progressive muscle relaxation is one important thing. Otherwise, I don't like to put much stretching and all because you do not know what pathology you have inside and what pathology you will create. Means what is the problem inside, what problem you may create. So we will go with the simple methods, right? What are they? Next. Here you can see what? These are the points. Put the pen one by one in this. Middle one, you use the point here and put the pen one by one here. The pain will go away within 5 minutes. It's called knuckle pain because the muscle of the pain is non-specific. It is used because of computers. समझ में आया आपको?
Yes, sir.
Yes, sir.
Yes, sir.
So the pain is always like this. If you put extension like this, like this, like this, you'll have a very severe pain in the neck of the muscle. So how to release this pain? Instead of putting needles, because you do not know 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now inserting 10 ml of injections in this area and relaxing it may also cause some other complication. Always avoid complications in the case. As a physician, we always advise avoid what? Avoid
Complications.
complication. Go for easy methods. What are they? Very, very easy methods. Next. Now you can see you can recover tendinosis in the insertion of the deep neck muscles. Now there is tendinosis here in the deep neck muscle. You touch here, you will feel lot of pain. On the deep touch, you will feel lot of pain. It is not always because of spondylitis. It is because of your lack of sleep and all these things, right? Irritation of the vertebral joints. Now you are, instead of doing this cochlear joint, this what you call, what do you do this one, na? Chiropractic techniques. So doing chiropractic techniques, you can use this type of method which recovers the patient very nicely and beautifully. So the one who can use injection is 2 ml and the needle size is 4.4 into 20 mm, right? Those who are physicians, they can use it. But be careful, you must always use what? Emergency drugs in your clinic. Patient may go in the stage of shock. But for those who are not acupuncturists, what will happen? Injection might ligamental frequently produce intense pain, and therefore injection is discontinued in case of high resistance. So you can see risks are always there in this method. It may also go to the epidural area and it may create large headache and it may create lot of problem in the patient. So never use this type of. I'll always advise never go for passive traction, orthopedic brace extension of the cervical spine. Always keep this one, and don't go for painkillers. Painkillers are not required. ODS is on painkillers, and I will teach you one technique by which you can recover this pain very easily. What are they? You see, this is the technique. Now, in this technique, what will happen? You may create lot of pain. Instead of doing that, put the neck like this and touch the advanced, what you call, brain pain, which like this. The same impulse will go.
Yes, oh,
Right? And the muscle will be relaxed.
maupay pag-start sa klase.
Right?
Maupay pag-start na mo.
Otherwise, you may create a cervical quadriplegia if you go with this method. But if you use this pain method, it is safe. Cervical method, you must be an expert of this subject. Very soon we are buying this, what you call, equipments. Siam is there, we can show you all these techniques in the Siam. But right now we are not using it because the wall has to be created. Later on, you can do all these techniques by what? Inserting one needle and touching a pain, and the pain goes away within minutes. Within what? Minutes. Now, treatment through muscles, tendons, and ligaments. Up to now, any doubts, please ask. कोई doubt है तो पूछिए.
So we have to use advanced brain pen over there.
You can use advanced brain pain or spine pain. Basically, I use Parkinson's
Okay.
pain because dopamine is released. Dopamine relaxes the muscles very easily. But whatever pain you have, you can use it. Advanced pain also okay, brain pain also okay. If you ask me, I use Parkinson's. I'll show you all these videos very nicely in the video, Facebook video. It is called Levator Scapulae pain. It is called Levator Scapulae pain. So the character trigger point in the area of the muscle is superior to the border of the tip of the medial scapula, frequently radiating across the superior border of the trapezius. So the pain comes from the back to the front. So how to reduce this pain? Now they say that you have to give fasciital injection in the C5, C6. I will never go with the fasciital injection because it is risky. Why will not I go? I will not go in the facets of the injection. That is what I will use. I'll use acupuncture needle and I will go with the pain stimulation. What pain stimulation I will use? I'll use the Parkinson's pain. But if you don't have the Parkinson's pain, you may use what? Brain and muscle pain. Write down brain and muscle pain.
What about the motor point pen, sir, the empty pen?
You can use motor point. Motor points are not used for this purpose. Motor point is used to integrate the local area with the brain. Brain and muscle is okay. Next. See, one thing I want to tell you, I am a busy physician, right? Hello, can you hear me?
Yes, sir.
Hello.
Yes, sir.
Yes,
Yes,
sir.
sir.
When it takes some
Yes,
time
sir,
to
we
come
hear
in the
you.
class, please don't mind it. Huh? Have patience. That is why I'm teaching you for free. I'm not asking any money, but I need some time. I have to complete my patient. I have to come back. And again, I have to look after a lot of documents. You can see this much NCV test I have to study. This much NCV test. And compare. Can you see? Can you see? Hello?
Yes, sir.
So you don't understand how much time you have to give to the patient.
It's very kind of you, sir.
But then only you know how to recover the patient.
Yes, sir.
See, I will not advise all this psychogenic traction and all. I don't advise it because psychogenic traction has its own side effect. In many countries, it has been banned. A lot of side effects have come up. Although it is written in the books and chapters, so we have mentioned it. But in personal experience, I won't mention it. My easiest method is what? Insertion of the needle very carefully, and if you cannot insert, touch the pain. If you shout like this, how will you understand the class? Do you really want to learn it? I don't know. Or I should stop the class.
Some people just have their microphones go off and they don't pay attention. That's the problem, sir.
See, we want to help them, meaning that they can recover the people who are suffering. We are not even taking money for that. Zoom class is paid by Singaporeans and all. That is the reason if you teach for free, people don't pay attention. You are teaching such a serious subject, which we have to complete in less than 1 hour. And then again we will revise it. You practice and then we'll again revise. Then I'll show you videos. Then you can easily recover the patient. Now these are the points, primary points here. 3 points are here. You put one injection, needle instead of injection, you put one needle or touch the pen, and the rest two you can touch the fingers. Clear? Take the photograph. One needle you put or put the pen on the primary point, and let's touch that. Because what you need to give is the impulse. What you need to give is the impulse. When you give impulse, the irritation of the nerve roots subsides and the pain recovers. Right? Now you will see main motion depends heading on the lateral aspect of the head. This lateral aspect of the head, you will get lot of pain, especially in the mastoid area of the ear, even in the radiating area, ear. You can understand you'll get lot of pain near the area. So what to do? Suborbital and frontal region. So the pain will go like this. Right? Pain will go like this. Now what to do? What are the symptoms? Bilateral watery eyes, vertigo. Pain increases when the hand is bent in the opposite direction, side and rotate of the same side. So if you bend the bend like this, you'll get more pain. If you do like this, you'll get more pain. Right? Now how to recover this pain? It may be because of vestibular headache or trigeminal neuralgia. Local anesthesia is 4 ml. I'll never advise local anesthesia to be used. Continental therapies are very simple. So now you can understand if you insert that needle deep, you may what? Puncture the jugular nerve and it may kill the patient. That is why I'm saying you have to be very careful while using acupuncture needle also. Why? You may kill the patient. You may do 100 cases successfully, but
Patient.
one case is unsuccessful. Your career is what?
Tarnished.
Finished. So always try to relax the neck. Today we have very good cervical pillows, and use this cervical what you call cervical neck collar. We call it cervical neck collar. These are the primary points you can see. These are on the carotid artery. If you make any mistake, what will happen? The patient will the park. And the pain is here. So what to do? Touch it with the pen. Which pen you will use it? If you touch it with the finger, it is very painful. If you touch with the needle, you may puncture the vein. So use it with the pen. So what will you do? 1, 2, 3, 4. Use it. Now you can say non-specific shoulder neck pain over here, trapezius muscles. You'll see lot of pain here. Tension headache, degenerative cervical syndrome, education treatment of the case of the obstructive respiratory disorder. You'll get lot of symptoms like this. So what to do? Next. Radicular symptoms means radiating pain. Pain यहाँ से लेके यहाँ radiate होता है. And nerve compartment syndrome, मतलब nerve impingement is there. Cervical spondylitis can be seen in this case. So what to do? Local anesthesia 5 ml, needle 0.4 mm into 20 mm. So never use this technique, my bab. You may create some problem for the patient. Use easy techniques, non-complicated techniques, right? Next. Here are the points. Very easy points. Touch the primary point and then touch with the pain. Which pain will you use? Brain muscle pain. Don't inject needles very much here because the veins over here, you may puncture the veins also. So my technique is very simple. Use the pain, the impulse, muscle will relax and the pain will go. After some time, the pain may come again. Again, you have to do it. Immobilize the neck. Pain will subside gradually. So this type of pain is increased when the pain neck is bent backside. You see the pain comes like this. Ah. So you have to reverse this what? Points. So your diagnosis is correct, your treatment is correct. Correct? And in sports injury, it is very, very good. I've taken this slides from the anesthesia book. So try less to practice. Those who are physicians, please try. Those who are not physicians, may please try with fingers, may try with whatever you can. Or don't try to use what? This lidocaine or something. If it gets one reaction, it will be difficult for you to manage because you don't have setup. Next. So here you will see, when you press the points, you will see the trigger points are there. Mark the trigger points, press the nerve, uh, touch the pain, and the pain will go. This pain is very easy to use. I always use this pen because I don't get complications and very good results, which you can see in Facebook. Just touch the pen like this, do like this. There is no risk. But very careful. The impulse which goes to the brain is very important. It must reduce endorphin and corticosteroids. Being a non-medical, you do not know what is endorphin, what is corticosteroids. But as a medical, you may know the importance of endorphin, corticosteroids. So if you use this sports injury, you can master anything like anything. Next. These are the areas. Go back. Yeah, these are the areas of the pain. These 4 areas. Do not give injection. Either put the needle carefully by seeing the picture or touch the pain. Pain will be relieved in 1 minute. Cervical spondylitis subject can be recovered in 1 day. But patient has to repeat the session. Next. Treatment through nerves. So treatment through nerves can be done through same needles, stimulations, through pressure, but pressure does not help much. So it can be helped through acupuncture needles. 4 options: acupuncture needles, pain stimulation, what you call lidocaine. Lidocaine I don't advise. The characteristic is the occipital headache irritating to the scalp and the suborbital region. So you will get scapular region. From here you will get the pain and it will radiate like this, orbital region. And from flexion to extension region of the neck. If you do this, the pain will change in the. If you do this, you get different type of headaches. And understand, 80% of the headache is used because of the cervicogenic problem. Am I clear? Relaxation therapies are there, all these things are there. Morning headaches are frequently caused by false sleeping. You sleep falsely and morning headache is created. So use the pen perfectly. The pain will go within 5 or 6 minutes. Less than 3 or 4 minutes, the pain will go. These are the points where you have to use. Be careful, there is occipital protuberance and knuckle line. So you don't insert the injection there. Neither the needle. Use stimulation because it is very cheap. Treatment through joints. Arthrosis, that is the arthritis of the spine. Joints causes inflammation and irritation of the vertebral joints. So degenerative changes in the spine causes lot of pain. So new arthrosis, magnosis in the deep neck muscles, and cervical irregularities also create this type of pain.
Air. Sino nasa banyo?
Close your mic.
Air.
Periodical injections are never advised.
Air, wag mo na ubusin yung gatas doon.
Injection in the deep cervical. Mute your mic, please. Don't laugh. And injection in the deep cervical area and artery it is vital and it may create a lot of danger. It is generally done by anesthetists. Even anesthetists do not do all these procedures. Neurosurgeons also avoid. They may go for surgery, but they don't go for. Mute the mic.
Melda from Indonesia, please mute your mic.
They never put the injection. Even the anesthetist who's working with me, we avoid going to these areas of the pain. We go with very minor area. Even my orthopedic surgeon and all, we avoid because it may create complication. If it creates complication, you are really in danger. The attendant of the patient, others, all will eat your head and it will spoil your image. So always try to go with what? Less complicated situation. Next. So it is for the anesthetist, not for you. These are the points which you can use, the needle and the pain. Best action is given by the brain and muscle pain and advanced brain stimulation. So we have completed a very complicated subject of cervical various radiculopathy in less than 1 hour. You may ask me your questions now. Ask questions. So difficult things you can do so easily. I've done large numbers. Even my orthopedic surgeon says I'll not go into that area. I, with the help of acupuncture needles, we go to the very deep area. And I just 2 minutes for a second out. There is no vertebral artery and it's blindfolded. You see arm. We never use CT scan. Blindfolded. Blindfolded. Just go needle inside and do it. Acupuncture needles are safest needle, and we don't use lidocaine because lidocaine if goes to the upper side, it any side effect is patient patient create lot of problems, and then there may be lot of medical legal cases. Here there is no legal case, nothing. You touch the pain, what patient will solve. Within 2 minutes the pain is gone. Change the lifestyle, pain is okay. So ask me your questions. No questions on cervical spondylitis. No questions. Any questions?
Yes, sir. Sanjay this side.
Yes, Sanjay, please, thank you so much. Ask me a question.
Sir, yesterday I have put a needle with. I have a patient with the cervical spondylitis with radiculopathy on the left side of shoulder with radiating pain towards the left arm. But when I had put a needle in the C4, C5 level, both sides. I used a spine pen. Then she became more. She had a trigger of pain for some time.
Yeah.
Why is it so that, sir?
That is why I say you must know the location. First, you have to relax the muscle. Then you have to immobilize the neck. Did you immobilize the neck after insertion of the needle?
Yes, sir.
Did you put the cervical collar?
after no, I didn't put.
Then you know there is a nerve impingement and you are allowed to do repeated injury. What will happen? It's a neurosurgical case. What will happen?
Yes, sir. But pain was relieved after 5 or 10 minutes, more than 80%. But
No,
during
that's okay. But after that, Sanjay, one thing we must remember,
yes, sir.
any type of such pain has to
Yes,
be
sir.
immobilized.
Okay, sir.
Why? Because if repeated injury is there, the pain will increase. These are all easy cases. If you do, you recover pain very easily. But if you do in a wrong manner, you get really wrong complications. I do a lot of cases with different anesthesists, and I found it really very different sometimes. Even in cases of Mohit, you see,
Yes, sir.
we did not inject it there in the
Lumbar
what you call
area.
CSF
Give the
area.
yes, sir. Yes, sir.
But all the symptoms were of CSF. And you see for 5 hours how much panic we had.
Definitely, sir.
Remember,
So
we could not
yes,
drink a
sir. Yes,
glass
sir.
of water.
That was very
Uh,
crucial time, sir.
so that is why I say, don't create complication in the clinic. Do your clinic safe and your practice will be very good.
So we have to relax the muscle first, then go for further for the nerve impingement area.
Yeah, because see, first is the nerve spasm in the nerve. If the spasm of the nerve is released, automatically the nerve is already released.
Yes, sir.
So these are the points which you have to remember. The videos will be given, the PPT will be kept.
Okay, sir. Thank you so much, sir.
More questions?
Pranam, sir. Mukesh from.
Yes, tell me, Mukherjee.
Sir, in case of ankylosing cervical spondylitis, we can use same technique.
See, ankylosing is totally different. Ankylosing also I will take a class. I'll take chapter by chapter. We have just completed one chapter, right? We have completed
Okay, sir.
chapter. One chapter is a typical headache, right?
Ji, sir.
One chapter we have completed with cervical with headache, right?
Ji, sir.
Because every cervical pain is not spondylitis, right? It is
Yes, sir.
arthrosis, it may be degeneration. You can see in case of this pain also, neck has not to be mobilized.
Yes, sir.
Simple mistake creates lot of what? Panic in the doctor.
Yes, sir.
So these are easy cases. Make it easy, not tough. How I do 120 patients? How do I insert? How do I recover the pain?
Thank you, sir.
It's much more easier because you do massage and all, you may pitch the nerve, you may damage the spine. Here there is no damage, nothing. Touch the pain with the trigger point and the pain is what? Gradually the muscle is released, lactic acid is released, the pain, then the spasm is gone, If you are expert in neurological, anatomical side, just go gradually inside the needle, touch the pain for 1 minute, take it out, pain is finished. You see large number of slip disc case I do with surgical one. Extruded disc, acute disc. Security I don't do. Extruded I do every day. Failure is okay. More cases. You love to know that we are getting cases from Gujarat and other places of coma and very difficult cases which cannot be recovered there. They have operated in Kokila Hospital and they could not recover that. And now we are recovering those patients. They are the best hospitals of India with best infrastructure. Infrastructure does not recover the pain. It is only your intention, intensity, and your sincerity and knowledge recovers the pain. Right? Video of the class you will get. More subject because I have to go to the OT room. 9 o'clock orthopedic surgeons are coming. We have a lot of OT procedures today. And NCV test, AMG test, EEG, all I have to study day and night and also. But then these are the evidence. I'll show you with evidence how much nerve has improved by this impulse. More questions?
Dr. Sastri, I'll ask a question. How do
Yeah, your voice is cutting down.
weightlifting worsens cervical issue?
See, whenever you lift a weight, the more pressure is put on the cervical area. So disc is already degenerated. Cervical disc is already degenerated. First, remember one thing. All the discs are normal functioning and they have a nutrition from the artery, right? All the discs get nutrition from the artery. One point is clear? Okay. One point is clear. You get nutrition from the veins and arteries. Am I clear?
It's clear, sir.
I'm asking Ian.
Clear.
Yeah. So with wear and tear, they create fibrosis, means it becomes hard. So whenever you put pressure, where do you get the maximum pressure? You put in the spine. So when you put in the spine, you put more in the trapezius, and the disc is already what? Weak. The moment you put the pressure on the disc, it compresses, it bulges, and the fibrosis of the disc is what? Break up. And the nucleus which is inside, it comes out and compresses the nerve root. So it deteriorates the condition up to paralysis and death.
Okay, thank you. How do MIBS help in this case?
The NIBA, it depends on which type of case you are dealing and who is dealing. If you ask me, I deal it with anesthetists, I deal with orthopedic surgeons. So we use acupuncture and all these two techniques together at the same time. and patient gets immediate relief, and then we immobilize the neck, and we don't need surgery for this patient. But certain cases need surgery. Surgery also may lead to quadriplegia, and other also leads to quadriplegia because of canal stenosis and compression of the cord. So you can recover these patients very easily. That is why I said acupuncture and all is an easy subject to recover. Only it is up to us, we don't recover this subject. Because our knowledge is very little on anatomy and physiology, and we don't practice much. Our exposure to patient is less. You must have a lot of exposure, you must deal with a lot of complicated cases, and you must know how to recover them. From spinal cord injury to make him walk, you must learn. More questions? More questions? Any more questions? Out of 118 people, only 5 questions. Now you understood. If you don't understand anatomy, you don't understand physiology, where you are struck off, you don't know what to do, what kind of pain it is, what is the indications, what is the diagnosis, and how will you recover? You put tongue point and the pain is recovered. Is it possible? Never possible. You must know all the critical points of which recovers the pain. Always remember with tongue point, pain may release, but the area may become bad. More questions? Any more questions? More questions? Any more questions? Any more discussion? You want to ask me anything?
Yes, good evening, sir. I just want to ask you that a ganglion on the palm can be cured by dialysis.
Understand, Anand Kumar Moria, what are the different reasons of headache? You told me, na, sir, what are the headache? How to reduce the headache? Moria ji, you understood?
Yes, sir.
Why did I say you need all this type of pains? Because all this pain has different impulses. It has to require a different potential inside the brain. Tongue acupuncture may
Yes,
release the
sir.
pain for some time, but can it recover the area? Can tongue
No,
acupuncture release all this?
no, sir. It is just a symptomatic treatment.
It's very symptomatic treatment, and I think that it is a good treatment. I never criticize any treatment, but you must know what is truth and what is untruth.
The result is quick,
I
but
made a slide. I made a very good
yes,
slide
sir.
for his mother's pain, but then he did not call me anymore, so I just kept it aside. how to recover his mother from this back pain. I made a very beautifully one picture.
Abhishek sir, mother sir.
Yes, yes, yes. I made it. I told him, Abhishek, I'll help his mother. Give me some time with the orthopedic doctor. How you can use blood plasma and all, by which she can recover very nicely and beautifully. By her, by Abhishek himself, he can recover it by using stem cells. I could have taught him, but since he is more interested in tongue acupuncture, he is interested in tongue acupuncture. He is interested in so many things. So it is better not to touch the people. See, until you are focused, until you go deep inside, can tongue acupuncture recover the nerves? Can tongue acupuncture? You see, in sports injury, how fast you can recover. I'm the first author. Even Lee is my student. Ask Lee. Let us put competitor who can recover pain faster. Anyone can compete with me with stopwatch, and I can show you within seconds pain can recover. Paralysis and all is very easy to recover. Only the thing is what you know, you did not create what? A group awareness, so that India can become a master of this subject. And that awareness has to come from inside you. I made the slide. Now I am not interested. Whatever he does, let him do. You must be in complete touch. Teacher Grove. What else we can do? I told him that by putting a plasma inside with the help of a nurse or with the help of an anesthetist, even not anesthetist is required, he himself can do it. 2 fingers like this, and then you insert like this, and then what? Blood plasma can what? Revive that area very nicely. The nerve can repair, and the patient can what? Recover for a longer period of time. This is what I was teaching you. That you are saying tongue acupuncture, this acupuncture, that acupuncture, TCM acupuncture. First, you know what is the diagnosis. Then treat the patient according to the diagnosis of the patient. Problem क्या पहले उसको समझो, फिर उसको ट्रीट करो. पेशेंट 2 मिनट में ठीक होता है. प्रॉब्लम हमें कुछ मालूम नहीं, हम ब्लाइंड थेरेपी करते हैं और पेशेंट को रिकवर करते हैं. Even the same thing in the case of orthopedic surgeon, he prescribes some medicines and he says, I cannot do any procedures. 80% people in India does not do procedures. You people also don't do procedures. Why? You put neck, this, because you are afraid of doing procedures. Learn, do, and become an expert. Because tomorrow is your time. Our time is finished. We are leaving this world after some time. Tomorrow is your time. Become expert and recover the world. I tell you, people will come from hundreds, thousands of miles. How people come to me? All they will come. Right?
Sir, how many sessions are required for to subside the or to recover a patient for the cervical spine with radiculopathy
In
or
my case, I always tell them 15, but people don't come up to 5. 3. I asked them,
3 or
why?
5
The pain
sessions?
is not there, everything is gone. Within 1 minute, the patient says, I'm okay, sir. What I will do?
It's with you, sir.
Did you practice? First of all, you tell me, did you practice?
Yes,
Did
sir.
you
We are
practice with
doing.
the anatomy of the spine? Did you take
Yes, sir.
the needle and did you practice with the needle and the anatomical models?
Yes, sir.
Did you really practice?
Yes, sir. I have practiced. Not too much,
So,
but I am doing it on the regularly basis after joining this class.
I'm joining this class. Before
Yes,
this,
yes. Before that, the subject was new to me. अभी पुराने होंगे ना सर?
Even the most critical coma patient, we try to recover, revive. We know he will die, but we revive the patients. During revival patient period, recovering in what? ICU is easy. After ICU, recover and so me, na.
very, very complicated, very difficult.
After ICU, recover the patient and so me movements and impulses of the nerve. I have this NCV test to prove myself that yes, how much it has recovered after every stimulation.
I will share a video with you. I have not
with you, with the group. Teach the people.
I will share it with the group, sir.
Don't share
We
me.
have a
Don't
patient
share me
with.
anything individually. Share with
Yes,
the
sir.
group.
I
Motivate
will
the
share.
people. See, why
Thank
am
I
I
you,
will
sir.
share,
teaching
sir.
you people? Because people must learn.
Yes, sir.
You must be spread because lot of local people can come to you if you spread yourself. If you do this, people will come to you. You will have your own pain clinic.
Yes, sir.
Am I correct?
Yes, sir. You are correct.
Now I'll teach you how to do what? Ozone therapy. Ozone therapy in what? Instead of doing what? Papa and Mama therapy, I'm going to practice. I've started practicing ozone very nicely. And I see patient's pain is gone within 2 minutes. What else you require? So, don't be afraid. Be a good physician. Practice with the anatomical models. Buy anatomical models and slightly go inside and see how you can study. Right? This is a small part of cervical muscular spondylitis. We'll go more deep inside. These are the chapters which you have to learn very much practically. I've taught you theoretically. When you come to me practically, I'll teach you practically. Because first I must teach you theoretically what you must understand. Right? How do I really recover coma patients? Why do coma patients come from 500,000 kilometers to me? Right?
Right, sir.
No. There is a difference between you and me. Understand? I don't give up a case. If I give up a case, I relearn it. You see my website, there are 250,000 evidences. You see your evidence, so less. So how will you recover the patient? Recover the patient, patient will be happy. And you will also be happy because you have really done good, family good, person good, no complication. Right? More important is creating impulse inside the nerve, which has to be very careful. right? So, Indonesian, some fellowship has been left. Please let me know. Any fellowship has been left. Please give me the name. I will issue all the fellowship. Right? Winnie, any? Winnie? Winnie?
No, Winnie is not in class, sir.
Winnie?
Winnie.
Please call me a message to any or Winnie. Any names are left, whose certificates are to be issued, I'll issue it immediately, right?
Okay, I'll send the message to
Any messages, any problem, please let us know,
Okay.
right?
Right,
Ian,
sir.
just tell me, Ian. Any more questions?
सर नमस्कार सर मुकेश राउत स्टार्टेड रिकॉर्डिंग नहीं अवेलेबल हुआ सर
हाँ
कल की रिकॉर्डिंग
मिल जाएगी प्रकाश जी से या अगर ये इनको दे देंगे वालिद you give the recording to Walid, this one what you called Prakash ji, right?
Yes, he's even recording right now. He's recording.
प्रकाश जी
as we
अभी
are
भी
talking
रिकॉर्डिंग
now.
कर रहे हैं वो YouTube पर अपलोड करके उनको भी समय नहीं मिलता है वो अपलोड करके आपको
But
सबको दे
anyone he
देंगे
doesn't have, I normally give him, so he puts it on YouTube.
हाँ
But he's
so you'll put on
recording right now.
YouTube
By
and
tomorrow,
from
I'm
YouTube
sure
you
they will
will learn it, right?
यस सर थैंक यू सर
और कोई रिक्वेस्ट आप लोग की तरफ से मेरे लिए कोई हुक्म एनी इंस्ट्रक्शन फ्रॉम योर साइड डू यू वांट एनी मोर सपोर्ट recover the
You are
problem
already
don't
supporting
keep the
us.
problem that's all any request anything can I do thank you so much it's 9 o'clock I completed as per time.
Thank you very much, Sastriji.
Thank you, sir. Take care, sir.
थैंक यू
My
सर
speed is slightly
थैंक यू
high
सर
because 1 minute.
Thank you,
1 minute.
sir.
1 minute. 1
Thank you,
minute.
sir.
1 minute.
1 minute,
Thank you, sir.
everybody.
Everyone.
Everybody quiet.
1 minute.
Thank
My speed is
you,
slightly high
Sasi.
because the subject is high. If you read my lectures again and again in the recording and understand very nicely, procedure is very simple. See the points, stimulate it with the pain or stimulate with the needle or stimulate with the injection. That's all. The procedure is given, everything is given. Rest is a practical subject. Do not try to give injections because if it creates any complications, you are directly in jail or you have to pay a fine. Any questions, Moroni?
सर मैं मुझे तोमर सर
हेलो
इसमें
Any more question?
सर मुझे तोमर बोल रहा हूँ
हाँ तो मर्जी प्लीज हुक्म कीजिए
सर जो स्पाइन में हम पेन इस्तेमाल कर रहे हैं स्पाइन पेन की इंटेंसिटी सर कहाँ तक बढ़ानी चाहिए पेशेंट बियर करे
कितना
उतना
पेशेंट
या
सहन कर सकते हैं
जी
पोजीशन आपको नेक के दिखाई हुई है राइट
हाँ वो सब सही है सर उसमें रिजल्ट
हाँ
अच्छा मिल
बस
रहा है
अब धीरे
पेशेंट को
धीरे
कर
के
ले रहा
नीडल
है
पे आ जाइए और नीडल पे
जी
जाते जाते उसको स्टिमुलेट कीजिए
जी
काम आपका बिल्कुल एक घंटे का काम 1 मिनट में खत्म
बिल्कुल सर लेकिन सर इसमें नुकसान बहुत हो रहा है
नुकसान बहुत हो रहा मतलब
पैसे नहीं देना चाहता ना पेशेंट
अरे आप पूरा मत कीजिए ना बाद में कीजिए ना आज क्यों ठीक करते हैं 10 दिन बाद ठीक कर दीजिए इतने दिन जो करना वो कर लीजिए
अभी सीखने की जल्दी है ना सर
देखिए मैं एक बात बताता हूँ हाथ को अच्छा बनाइए मनी विल कम
जी सर
डोंट
यस
रन
सर
आफ्टर द मनी Still, I teach you and I practice you today every day. Even I tell you, after taking ketamine, I can do all these procedures. 2 ml ketamine मार दो, 20 मिनट के बाद मैं जाके प्रोसीजर करके आ जाऊंगा. I challenge my orthopedic surgeon. Can you do it or I will do it? Sir, I will do it. All the way I climbed down, what, second, third floor. I went to the OT room and I asked him, do you need my support? No, no, sir, I will do it. So any more questions? Be a good physician. Support others, spread others. सबको दोगे सबको तभी मजा आएगा. अकेले खाओगे कुछ मजा नहीं आएगा. Share and eat. Right? Thank you so much. Videos you will get.
Thank you, sir.
Thank you, sir.
Thank you, Sastri ji. Good night.
Thank you, sir.
Thank you, sir. Thank you, everyone.
Good everybody.
Good night,
Shutting down
everyone.
class.
Thank you, sir.
Shutting
Night,
down. Good night,
everybody.
everybody.
Everyone.